The following steps are presented in a specific order to make your process as fluid as possible. Once you have a hand with the system, feel free to adjust your routine. We recommend that you follow this order to begin. There are 6 basic steps in the discharge workflow. First, discharge follow-up. Second, patient education. Third, medication reconciliation. Fourth, discharge orders. Fifth, discharge instructions and orders. And sixth, discharge summary. To put in the patient's discharge follow-up, go to the Discharge tab of your specialty view and select Follow-up. For trauma clinic follow-up, make sure you have a location selected, type trauma, and then select Intermountain Medical Center Trauma Clinic. Always put a date, but not time, when scheduling follow-up, and make sure to schedule it for Thursday as trauma clinic is only open on Thursdays. Not very many of our patients actually need follow-up in the trauma clinic. The indications for follow-up in trauma clinic are listed on the website on the Discharge Workflow in the follow-up section. Ultimately, trauma clinic follow-up is at the provider's discretion but can include the following: grade 3 or higher solid organ injury, unresolved pneumothorax or hemothorax, 3 or more rib fractures or rib fractures in high-risk patients such as elderly or those with underlying pulmonary disease, and high-risk wounds. Patients operated on by a trauma attending should be seen in 5 to 14 days post-op in the trauma APP clinic and again in 1 month with the operating surgeon. Patients being seen for follow-up of pneumothorax, hemothorax, rib fractures, or rib plating should all have chest x-rays done the day prior to their appointment. Patients with mild traumatic brain injury and all patients with traumatic brain injuries that did not have a neurosurgical consult can be seen in follow-up at the Intermountain Neurosciences Institute Physical Medicine and Rehab Clinic. Elderly patients admitted after a fall or those with significant fall risk should be referred to the Live Well Center for the Falls Prevention class. This can be ordered in iCentra as the Live Well referral. Please make sure that all these patients follow up with their primary care physician and include any home medication changes that may be relevant to their fall. Any patient that's diagnosed with a DVT or PE during admission should also follow up with their PCP. Those with distal DVTs should have a Doppler ultrasound at 1 week and again at 2 weeks in hospital or after discharge. Patient education can be added on this same tab of the discharge workflow. Please take caution and make sure to review any education that you add here, as many of these documents have not been reviewed by our team and may contain misleading information. It is best to keep this very simple and allow all consultants to put in their own discharge patient education. Discharge medications are done through the Discharge Medication Reconciliation in the same location that you would do an admission or transfer reconciliation. If sending a patient home with narcotics, please use the MME calculator to make sure that we are at a goal of less than 50 MMEs a day by hospital discharge, and please incorporate a wean of 25% MMEs a day. You must provide prescriptions for all controlled substances if a patient is discharging anywhere but to the IMC acute rehab. If you're sending a patient home on gabapentin, provide a 30-day supply, and anything beyond that can come from their primary care physician. If they are on more than 300 milligrams 3 times a day, and you intend for this to stop, then please include a weaning schedule. For antibiotics, please include an indication and a stop date. For all anti-epileptics, please make sure to also include a stop date as recommended by neurosurgery or neurology. Always refer to our clinical practice guideline for discharge VTE prophylaxis and therapy. Please also clearly document the stop date that is discussed with the attending at the day of discharge. Discharging a patient to the inpatient rehab at IMC, do a cross-encounter discharge medication reconciliation instead of the standard discharge medication reconciliation. DC all therapy orders, electrolyte protocols, and bowel protocols from your medication reconciliation, as these can be reordered as the attendings prefer in rehab. To place your discharge orders, you want to search for the Discharge Orders Phased Power Plan. This power plan will be used for all discharges except for those who are transferring to IMC inpatient rehab. In that event, you would use the cross-encounter transfer order set. For those patients discharging to a skilled nursing facility, it is important to select the skilled nursing facility and SNF certification orders under this power plan. If the discharge orders are done by anyone other than an MD, then these must be routed to the attending surgeon for their signature. This is done by right-clicking on each of the skilled nursing facility and SNF certification orders, selecting Modify, and then choosing the first of this drop-down menu. Then right-click again, and this time select Ordering Physician. Type in the physician's name, and then select Signature Required. When discharging a patient home with home health care, it is important to understand that both outpatient services and home health care cannot be ordered at the same time. With most insurances, ordering home health care requires that the patient have some degree of homeboundness. You only need to write prescriptions for DME if the patient is discharging home. If you are sending a patient home on oxygen, discuss the specific order with the respiratory therapist and place the order here in this power plan. If you're sending a patient home with a wound vac, it is important to discuss what they need with the wound care specialist. If a patient is discharging home with outpatient therapies and they live in the Salt Lake Valley, and if they do not have a preference for the location, then we prefer the Tosh Neuro Rehab. If discharging a patient to the acute rehab unit at IMC, please refer to the Inpatient Rehabilitation Patient Transfer Trauma Clinical Guideline. As stated before, use the Cross-Encounter Discharge Power Plan. The second to last step in the discharge process is to complete your discharge instructions and orders form. Once everything else is complete that has previously been discussed, go to your trauma specialty view, select the Discharge tab, and then select the document entitled Discharge Instructions and Orders. This will automatically compile all of the information that you have previously put in for the patient's discharge. The only thing you have to add on here is scroll down to Additional Patient Instructions, select the Enter button, and then type in .tr handout. Once you are complete with this and ready for the patient to be discharged, then sign and print this form and put it in the patient's chart, or give it to case management if they are discharging to a skilled nursing facility. The final step is to complete your discharge summary. This is converted from your normal trauma progress note. So if this was a complete trauma progress note, and you had the .tr floor template in the assessment and plan part of your note, just below disposition, add the dot phrase .tr dc, and then fill in this information here. When you save the note, save it as the note type Discharge Summary, and save the title as Trauma Discharge Summary. For inpatient deaths, convert the progress note type to Discharge Summary. Do not delete the daily progress note from the discharge summary for billing purposes, and add a brief death note at the bottom of the note.